Before I enter my patient's room, I reviewed his chart and medical history. Now I'm going to go ahead and knock in and get started. Hello, Mr. Snowman. My name is Yesenia, and I will be your nurse today. Today, we will be performing a head-to-toe assessment. Before I get started, can I take a look at your name band? And can you state your full name and date of birth for me? Thank you. And can you tell me where you're at? Can you tell me what we will be doing today? And can you tell me the name of the President of the United States? Thank you, Mr. Snowman. And on a scale of 0 to 10, what is your pain level today? 0 being no pain at all, and 10 being the worst pain you've ever felt. 0. Okay, before I get started, do you have any questions regarding the procedure? Okay, do you understand what we're doing today? Okay, perfect. I'm going to go ahead and close the curtains for privacy and wash my hands so we can get started. Okay. I'm going to start off by checking your vitals. First, your temperature. I'm going to stick this thermometer under your tongue and have you close. 98.6, normal, perfect. And check your heart rate for 1 whole minute. 70, and your respirations are 14. They're both within the normal range. Next, I'm going to assess your blood pressure. Alright, as I do this, I'm going to ask you to make sure your legs remain uncrossed. Okay, we're going to pretend this is the right size, and it's going to stay on. Okay. Okay. Okay, I'm going to inflate and deflate one more time, okay? Okay, I'm going to slowly deflate. I heard the first sound at 120 and the last sound at 80. So your blood pressure is 120 over 80. It's very good, Mr. Snowman. Okay, I'm going to start off by assessing some of your cranial nerves. First, I'm going to check your facial nerve. Can I have you smile for me? Can I have you frown? Can I have you puff up your cheeks? Okay, you can deflate. Now, can I have you close your eyes tightly? Okay, open. Thank you. Now I'm going to check your hypoglossal nerve. Can I have you stick your tongue out and move it from side to side? Thank you. Now I'm going to check your accessory nerve. Can I have you move your head from side to side? Up and down. And shrug your shoulders. Very good. Okay, now can I have you stand up? Place your feet together and stick out your hands like this. Very good. I'm just checking your balance. Okay, can I have you do the same thing but with your eyes closed? And I will be right here in case you lose your balance. Okay, very good, Mr. Snowman. You can go ahead and sit back down. So I'm going to wash my hands and put on some gloves. Okay, now I will be palpating your scalp. I'm feeling for any bumps, lesions, or abrasions. Okay, everything. I don't notice any abnormalities. Everything feels normal. I'm going to go ahead and take my gloves off and wash my hands one more time. Okay. Now can I have you stare up at the ceiling for me, and I'm going to pull down on your conjunctiva slightly. Okay, your conjunctiva is nice and pink and your sclera is nice and white. That's exactly what we want to see. Now I'm going to assess some other cranial nerves. I'm going to assess your oculomotor, trochlear, and abducens. Okay. first thing I'm gonna have you do is follow this pen light without moving your head. And I'm just assessing for any involuntary eye movements. Okay. Now can I have you look at the wall behind me while I shine this pen light in your eyes? Okay, I'm gonna do the same thing with the other side. Okay, your pupil size was a 3, which is normal, and your eyes were equal, round, and reactive to light, which is exactly what we want to see. Now I'm going to check the accommodation. Without moving your head, can you follow this pen light for me? Okay, perfect. Now can I have you tilt your head back? I'm going to shine this light in your nose. I'm just looking for any redness, any abnormalities, or drainage. Everything looks fine. Now can I have you occlude one side, one nostril, and breathe in? And do the same thing with the other side. Okay? Just checking the patency. Sounds normal. Now I'm going to check your temporal mandibular joint. Can I have you open your mouth and close? Can I have you clench your teeth? Okay. I'm going to have you open and close your mouth one more time, but I'm going to apply a little bit of resistance. Okay. Everything feels normal. Now I'm going to go ahead and wash my hands and put on some gloves. Okay, I'm going to be checking your mouth. First, I'm just going to observe your lips. They're nice and pink, and they look hydrated. Now, can I have you open up? I'm going to shine this light in your mouth. I'm just observing your teeth, your gums, the inside of your mouth for any redness or irritation. Everything looks good. Now I'm going to assess your glossopharyngeal nerve, your gag reflex. So I'm going to be sticking this tongue depressor in your mouth, okay? Just say ah. Okay, your gag reflex is intact. Very good. I'm going to take my gloves off and wash my hands again. I'm going to feel around your ears, the palpate. Let me know if you feel any tenderness. Okay. Now I'm going to assess. I'm going to shine this pen light and look at the outside. I don't see any lesions, no redness. Okay, now I'm going to pull up and back and shine a light. Okay, same thing with the other side. Pull up and back. Okay, everything looks good. Now I'm just going to be assessing your lymph nodes. See if I notice any swelling or tenderness. Let me know if you feel any tenderness as I palpate around your. Okay, thank you. Okay, everything looks good. I'm just going to go ahead and listen to your heart sounds now. I'm going to start at your right second intercostal space. Be listening to your aortic pulse. Now the left second intercostal space, I'll be listening to the pulmonic. Your left third intercostal space, Erb's point. Then fourth intercostal space is tricuspid. Now your fifth midclavicular space, I will be listening to the mitral, which is a point of maximum impulse. And I will be listening for 1 full minute. Okay, I will be doing the same thing but with the bell to check for any heart murmurs. Okay, now I'm gonna just palpate the point of maximum impulse. Okay, next I will be listening to your lung sounds, and each time I move my stethoscope, I'm gonna ask you to take a deep breath, inhale and exhale, okay? I'm gonna start at your apex, do both sides, move down to your second intercostal space, both sides, fourth intercostal space, both sides, and then 6 mid-axillary space, same thing both sides. Okay, your lungs sound clear, and I'm gonna have you turn around now so I can listen to your lung sounds one more time. And same thing, just inhale and exhale each time, okay? I'm gonna start at the apex. Both sides. Now from C7 to T3, I'm gonna be listening to the upper lobes. And from T3 to T10, I'm gonna listen to your lower lobes. Altogether, there are 18 points, and I will be rotating back and forth, and each time I will have you inhale and exhale. Okay. Your lung sound clear. Okay, thank you very much. Go ahead and turn around for me. I'm going to be checking your capillary refill. Under 2 seconds, that's perfect. Okay, same thing with the other side. Now I'm going to be checking your skin turgor. Okay, it's non-tenting. Very good. Okay, and now I'm going to check your deep tendon reflex. I'm going to check your patellar reflex. Just going to tap your knee. Okay, good. Same thing with the other side. Okay, good. Very good. Now you can go ahead and lay down for me. Thank you. First, I'm just going to be inspecting your abdomen. Okay, I don't notice any, your skin is intact, and I don't notice any abnormalities. Now I'm going to go ahead and auscultate. I'm going to listen to all 4 quadrants, starting at the right lower quadrant, okay? Can move up to the right upper quadrant, left upper quadrant, and left lower quadrant. So bowel sounds are present in all 4 quadrants. Now I'm going to be palpating each quadrant in the same order, and I'm going to have you let me know if you feel any tenderness or pain as I do this, okay? All right, thank you very much. Now I'm just going to check the capillary refill and your nail beds on your feet. Under 2 seconds as well, perfect. I'm going to check your pedal pulses. Okay, very good. You can go ahead and sit back up for me. The only thing I forgot to do is check your carotid pulse, so I'm going to go ahead and do that. Okay, now I'm going to check the other side. Equal and bilateral. And I will check your radial pulses too. And then we will be all done. Equal, strong, and bilateral. Okay, very good. All right, Mr. Snowman, we're all done with today's assessment. Do you have any questions for me? Okay, I will go ahead and document and let your doctor know our findings. Have a nice day. So I'm just going to go ahead and document my assessment, and we're all finished.